Hello everyone, and welcome to this webinar session on managing parental anxiety in short consultations. My name is Zoe Ellis, and I'm the Head of Consumer Medical Affairs at Nutricia, and I'll be your chair for this evening. Today, we're really excited to have Dr. Vanessa Bogle join us to share her expertise in this area. Vanessa is an experienced chartered psychologist, accredited as a BABCP cognitive and behavioral psychotherapist. She holds a master practitioner diploma in eating disorders and obesity, including nutritional interventions, and has been a member of the Motivational Interviewing network of trainers since 2005. Vanessa regularly provides training for a range of clinicians to enhance their skill sets and helping them facilitate change in others. And we're very grateful she has found the time to be with us this evening. Vanessa's session will be around 35 minutes long. Now you'll see to the upper right of my video screen that there are a variety of resources which you can download for free, including a digital diagnostic tool to help differentiate symptoms and diagnose feeding issues such as reflux and colic. During the talk, please submit your questions via the Q&A box to the bottom right of this video, and these will be answered by Vanessa following the presentation. And now, without further ado, we will move on to Vanessa's talk. Over to you, Vanessa.
So this webinar will focus on parental reassurance and managing parental anxiety during short consultations using a motivational interviewing approach. So I thought we'd start by looking at how we define reassurance. And reassurance is a statement that removes doubts or fears, the effect being to comfort. But how do we know when reassurance has been achieved? Well, we know when a change in behaviour, thoughts or understanding has occurred. And we also know that good communication is vital and that good communication underpins high quality care. And also that there are key qualities considered to impact really positively on that parent-practitioner relationship, and that includes empathy and warmth. So establishing good rapport and trust with parents, in addition to expressing empathy. And empathy is about the ability to be able to see the world through the eyes of the other person, and also the ability to be able to communicate that back to them. And providing relevant information is also key in effectively reassuring parents. And what we know is that if we use suboptimal approaches, this can be really distressing for parents. We also know that it's really important that parents feel listened to and that they feel understood. And what we know is that if parents aren't reassured effectively, that this can lead to a real vicious cycle where the parents' anxieties will be heightened, and that then leads to them returning to receive more reassurance seeking. So it actually keeps that vicious cycle going. So, we can take a closer look at some of the possible outcomes related to the use of suboptimal approaches to reassurance. So we can see from this diagram that repeated reassurance seeking is often driven by anxiety, and the anxiety is around the worry about the health of the child, and this then leads the parent to seek reassurance. So that they'll book an appointment, they'll come along, and if the reassurance hasn't been effective, it will actually provide the parent with some short-term relief, but because they haven't been reassured effectively, they continue to believe that there is a problem with their child's health, and they will then come back again and seek reassurance. So in the long term, it really perpetuates reassurance seeking behaviours, and that vicious cycle continues. So how do we, how can we improve communication and provide effective reassurance? Well, we can do that by using some of the principles of motivational interviewing that I'm going to go on to share with you. So what is motivational interviewing? Well, it's a very respectful style of communication. It's collaborative in that it's not something that we do to people. You know, we do it in partnership with people, and we do it with and for people. Motivational interviewing, it's a goal-orientated style of communication, and the goal is for behaviour change, and it pays particular attention to the language of change. And what we're trying, you know, the language that we're looking to elicit is change talk, and change talk is parent speech that favours making a behavioural change. So it's designed to strengthen intrinsic motivation for and commitment to a specific goal. So the specific goal here might be for the parent to engage in baby soothing techniques. And we do that by really eliciting and exploring the person's own reasons for wanting to change. And it's done within an atmosphere of complete acceptance, and it's done with compassion, it's done with kindness. It's giving the priority to the needs of the parent rather than our own. So that's a bit of a mouthful, but that's a good overview of what motivational interviewing is. So just moving on to what we call the spirit of motivational interviewing. And this is really about the heart set and the mindset that we enter conversations with parents. And there are 4 characteristics that help us to describe what we refer to as the spirit of motivational interviewing. And that's that it's a partnership. So it's an equal, respectful partnership. It's something that we do for and with parents. I suppose in essence, it's a way of looking at something together. The second aspect is acceptance, and this is where we accept the person as they come, and that includes being able to express empathy, being non-judgmental, and sometimes that's easier said than done. It's also about providing affirmations, and affirmations are statements that comment positively on a strength that you have evidence of within the parent. So you might be commenting on their intentions to do something or progress that they've made. And acceptance, also an important part of that, is respecting, you know, the right for a parent to flex their agency. So it's really about respecting parents' autonomy. The third aspect that helps us describe the spirit of MI is compassion. And that's where we deliberately commit to giving priority to the needs of the parent over our own, where we promote and pursue their welfare and their best interests. And the last aspect that helps us to describe the spirit of MI is the fact that we use an eliciting style. So what we're aiming to do is to elicit the parent's own perspectives and their own reasons and their own motivations for change. And I suppose the spirit, as I said, the spirit of MI is about the heart set and the mindset that we enter conversations with parents. And I suppose that this is what really brings the conversation to life, because, you know, using good listening skills are paramount. And I suppose good listening skills, if we just simply used good listening skills, so, you know, asking open-ended questions, etc., in isolation, you know, in the absence of the spirit of motivational interviewing, the conversation can feel quite empty, quite cold, quite mechanical. And the spirit of MI, I suppose you can liken it to the spirit being the music that goes along with the words that really give it life. So the spirit of MI is very important when we're having these conversations. So you may have heard of this saying, you know, you can lead the horse to the water, or in this case, you know, you can drag the horse to the water, but you can't make the horse drink it. What we know is that human beings have a really strong built-in desire to put things right, you know, to fix things, to prevent others from harm. And that comes from a really good place. And that strong desire can sometimes really lead to practitioners telling patients or parents what to do, and to give unsolicited, unwanted advice, etc. And in many cases, this approach is counterproductive. And that's because most people, not everybody, but most people don't like to be told what to do. And there is a theory in psychology called reactance theory that helps us to explain why those more telling, persuasive approaches are often very effective in facilitating positive behaviour change. And that theory proposes that if people feel as if their right to act autonomously is under threat, that the almost automatic response is such that one will dig their heels in, very similar to the horse that you can see on the screen, and really fight for their right to act autonomously. So as an example, when a parent is ambivalent about trying out a new baby soothing approach, and the practitioner might then present the positive aspects of changing that behaviour, of trying it, the natural reaction of the patient is sometimes to voice for the other side of change, i.e. why it would be difficult to try out that new baby soothing approach. Now, this doesn't mean that the parent is being difficult or a sign that they lack motivation. It simply represents that the person is wanting their ambivalence, that feeling in two minds, to be really listened to, understood and heard. So reactance theory goes some way to explain why the more persuasive directive approach are largely ineffective when we're trying to facilitate positive changes. So just a bit about communication styles. So there are typically 3 styles of communication, and I suppose you can view them on a continuum. So at one end of the continuum, we have what we would refer to as a directing style, and that's where we tell the person what to do, we take charge, we take the lead. And then the other end of the continuum is what we would refer to as a following style. And that's where we just allow somebody to be, and we just be with them. We just go along with them. We just follow them. And then you have a style that sits somewhere in between being directive and following. And we refer to that as a guiding style, where we support someone, we encourage them, and we assist. And that's where motivational interviewing fits in. So what I'd like to do now is to show you a mock consultation where a directive style is being used.
Good morning, Mrs. Pearson. I haven't seen you for quite some time. How are you doing?
Not great, to be honest. I'm really struggling. Max is crying all the time because of his colic, and nothing that I do seems to help.
And have you tried any of the techniques that can help to soothe colic babies?
I don't really know what the techniques are.
Well, don't worry, I can go through them with you, but the good news is that colic usually stops at 4 months or by 6 months at the latest. There are a number of different techniques that you can try. There is light at the end of the tunnel. You are important as well as Max, so make sure that you set some time aside for some self-care activities each day.
Easier said than done.
Yes, but it's really important and you do deserve it. So, there are lots of options for you to try. Do you have any questions?
There's a lot to take in.
I know, but don't worry. I have a leaflet here that summarises all the techniques that we've discussed today, and it goes into the techniques in more detail, and you'll find this really, really useful.
Thank you.
Just remember that if you do have any concerns in the future, you can contact your health visitor, or you can always come back to see me.
Okay.
So our discussion today has been helpful. Have you learnt anything new?
Yeah, I have. I have learnt a lot. It's just I still don't feel that confident about the techniques.
I understand, but the more you practice, the easier it will get. Good luck going forward with putting the techniques into practice. If you feel that they don't work immediately, just try to stick at it.
Okay, I will.
Now, we've talked a bit about the importance of communication. And what we know is every good conversation starts with good listening. But most people, when we're conversing, most people don't really listen with the intent to really understand the other person. They listen with the intent to reply, to put their penny's worth in, to give advice, give their opinions, sometimes when it's not wanted. But if we're really wanting to help and support somebody, you know, we must be in a position to understand them. You know, if we don't understand the other person, we're not going to be well placed to be able to help and support them. So what I'd like to move on to now is just to share with you some of the key listening skills. And the key listening skills in motivational interviewing are known under the acronym of OARS. And if you just look at the picture on the bottom there on the right, if you imagine that you are, you know, on a boat and the water's very still and you have no oars, you probably, you know, you're not going to get very far. But if we use our oars, our oars will help us to get somewhere. So our oars will help us to navigate our way through these conversations. So the O in oars stands for open-ended questions. And open-ended questions really would invite the parent to really tell their story. And open-ended questions typically cannot be answered with a single word or phrase. They're questions that are framed in such a way that encourages the parent to really express their concerns and their opinions, which is really important. And then we have affirmations that I mentioned earlier, and affirmations are statements that comment positively on a strength that you have observed within a parent. So you might be commenting on their trying out of a certain baby soothing technique or their intention to do so. But it must be based on evidence that you've seen, something that they've said. Otherwise, it can damage rapport if the parent feels that that you're not being genuine in your affirmations. The third key listening skill is reflective listening, also known as empathic listening. And these are, in essence, they're statements of understanding. What you're aiming to do is to take a guess at what the parent has said rather than assuming that you know. So you're attempting to understand the parent's subjective experience rather than assuming that you understand. So what you're doing is you're listening attentively to what the parent has said, and then you are saying it back to them in your own words. And then the last key listening skill are summaries. And summaries are, a way of thinking about summaries are that they are a collection of reflections. And summaries is something that you do periodically during the conversation. And it's really important that with both reflective listening and summarising, that when you hear the parent expressing any motivations for change, that is reflected back to them, that is said back to them, because it's really helpful for people to hear what they say about themselves. So expressing empathy is extremely important. And what can help us to express empathy is the use of reflective listening. That will really help us to understand the parent's lived experience. So what we're doing is a way of thinking about it is that, we are wearing different glasses. So let's say I'm wearing the yellow glasses. So I will see the world differently to the parent. So when I'm in the room with the parent, if I really want to understand the parent, what I need to do is to take off my yellow glasses and pop on the purple glasses so that I can really try to gain insight in what the parent's world is like for them. Because if I can do that, I will be in a stronger position to be able to support and to help the parent, rather than assuming that I know what their lived experience is. So what I'd like to do now is to share with you a brief video about empathy.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So there is usually a point in these short consultations that we have with parents where, where we would like to share some information with them. And there is a really useful strategy that can help us to do this in a very respectful way. And it's known as the EPE strategy. And EPE stands for elicit, provide, elicit. So our starting point, a starting point that's really helpful is actually assuming that the parent knows something about the topic. So, so it's very different to enter a conversation and our belief is that the parent knows nothing, they're an empty vessel, and our role is to give them lots of information. It's really helpful and respectful to assume as a starting position that the parent knows something. So what does this look like using the EPE strategy? So this is what it might sound like. So what do you already know about colic? So you're eliciting from them what they already know. And when they tell you what they know, you can then affirm them, because we know that that's a very key listening skill. Or we could also ask, would you like to know more about the ways to manage reflux? Is there any information that I can help you with today? So once we've elicited information and we've affirmed them, if that's appropriate, if they have shared their knowledge, we can, with permission, ask to share information, because what we don't want to do is to give unsolicited information. And it's respectful just to ask permission, because again, that will help to really develop that rapport. So in sharing information, we might, we would ask permission. So would it be okay if I shared some information with you? If they say yes, we share information. So colic is common and often the consequence of an infant's maturity. So we share information, and the last E in the EPE strategy is making sure, once we've shared the information, is checking back with the parent. and not assuming that they've understood the information that you've shared with them. So what do you think of that? What sense do you make of the information that I've shared with you? Because what's really important is that the parent has understood, because they might be sitting there and nodding, but thinking, I didn't quite understand that, but I feel a bit silly asking. So just checking out what sense they've made of the information that you've shared can be really helpful. And also asking, what do you think your next step might be? So it's just an open question, it's non-threatening. So this EPE strategy can come in very useful when sharing information, because it's done in a very respectful way. So what I would like to do now is share with you a video that demonstrates a guiding style. And a guiding style, as I mentioned earlier, is a style of communication that's used. It is the MI approach. So it sits somewhere between directive and following. And the directive aspect is that actually we are focusing on a specific aspect. We're not just following the parent aimlessly talking about everything and anything. So we're definitely not using a following style, and we're definitely not using a directive style. We're not taking hold of the reins, we're not taking charge. It sits somewhere in between. So the directive element is that, we are talking about, we're talking specifically about child, but we are allowing the parent, some freedom in that conversation. So it sits somewhere between directive and following.
Good morning, Mrs. Pearson. I haven't seen you for a while. How are you doing?
I'm just hardly getting any sleep. Max is crying the whole time. I'm just really struggling right now. I think it's because of his colic.
So things are really tough for you right now.
I hate seeing him in this much pain, and nothing that I do really makes it any different. I feel in a way like he's just telling me he doesn't want me.
So Max is really important to you. You love him dearly, and it's difficult for you to see him in such distress. And feeling as if there's nothing that you can do to make things better. And you feel as if these are signs that perhaps Max might be rejecting you.
I just feel so guilty. I feel terrible most of the time.
I'm sure you do. I can only imagine. It's really challenging having a child with colic. It's particularly difficult for first-time mums. It's tough. And you feel as if you might be doing something that's contributing to the problem.
Exactly.
Would it be okay if I shared some information with you?
Sure.
Yeah. So colic usually stops at 4 months or 6 months at the latest. What do you make of that?
Yeah, that's good to know. It's good to know that it's not going to go on forever.
So just so I can start to get a picture of what things are like for you, could you talk me through a typical day, just so I can understand where the colic fits in? So from first thing in the morning through to last thing at night.
Yeah, sure. Normally Max wakes up about 6 and I give him a bottle. He normally drinks the whole thing and I wind him. I wind him before and after every feed he has during the day.
And that's really good, because that's one method that can help. And you also hold Max and rock him over your shoulder, and that can sometimes work, but only for a short period of time. So you are doing lots of things really well already. So I mentioned earlier that I had some information that I could share with you. Would you like me to share that information with you now?
Yes, please. I would feel more comfortable if there was someone else there. I'm sure my partner would be pleased to help, so I'll definitely maybe give that one a go.
Yeah. So giving Max the bath and asking your partner perhaps to do that might be an option.
Yeah, definitely. It's definitely something to think about.
So I've shared a number of techniques with you. What do you make of them?
Yeah, I like them. The white noise and the rocking in the pram and the bath. I think that could work.
And which one might you try first?
Probably the bath, I think, because in the evening that's when I'm most tired and when Max is most upset, and my partner wants to help, so I can let him do the bath and he could probably put Max to bed by himself as well.
That sounds like a really good idea. So what I've noticed is that there isn't really much time in the day for you. Self-care is really important for your well-being. You know, you are important as well as Max. So, you know, this could perhaps give you some you time.
Yeah, I suppose. And, you know, with any luck, if those techniques work, I might be able to have a break or even a nap when Max is asleep.
Do you have any other concerns that you'd like to discuss today?
No, that's been really helpful, thank you.
Okay, so I have a leaflet that summarises the range of techniques that we have talked about today, and I've marked the techniques that you might find most relevant, just so that it's easy for you to find.
Okay.
Will that be useful?
Yeah, really helpful. Thank you for that.
So you seem quite confident going forwards.
Yeah, I do feel more confident. Now I've got a few more tips up my sleeve. Yeah, I do feel more confident. Thank you.
And if you have any concerns in the future, you can contact your health visitor, or you can always come back to see me.
So what I'd like to share now with you is a infographic that really summarises some of the key tasks that can help you to navigate your way through these conversations with anxious parents. And hopefully you would have seen this in the guiding style video that you've just viewed. And you can see that establishing rapport with a parent is really important. And what will help with that is throughout the conversation will be listening. And a good benchmark is, is a parent doing at least 50% of the talking? Am I expressing empathy? Am I demonstrating that I'm listening to the parent, listening to their concerns? And am I communicating it back to them? You know, it's about agreeing an agenda to make sure that the conversation remains focused. And remember that the parents' concerns are an important part of the agenda. So this is about inviting the parent to add to the agenda and being very clear. And it sounds very business-like, but it's quite helpful to kind of agree what you're going to talk about, particularly when the consultations are brief. We've talked a lot about the importance of listening and utilising listening skills known under the acronym of OARS, because that can really help us to understand parents and their concerns. We talked about the EPE strategy that's really helpful in sharing information and the importance of asking permission because it's respectful and it helps to build rapport. And if we think about, all of this together, using the listening skills, expressing empathy, what we're doing here is we're exploring and building the parents' confidence in their ability to manage the difficulties that they're being faced with. And, these skills will hopefully help us to be able to reassure parents effectively, which hopefully will then break that vicious cycle where parents feel as if they're not, they haven't been reassured, that they might get that short-term relief, but actually that short-term relief leads them to still believing that there really is a problem with their child's health, and that cycle will just perpetuate. So what you'll see is a parent comes back again and again and again. So hopefully these skills will help you, to manage these sometimes difficult conversations, particularly when we have short periods of time. So in summary then, we know that, your style of communication, our style of communication can greatly influence what parents say and hence what they do. And we know that also that if we converse in a collaborative manner, viewing the parent as an equal, you are obviously an equal, you are obviously a professional, you are a health professional, you are an expert, but actually it's recognizing that the parent is an expert about themselves. So entering that conversation where there are two experts in the room, we use that evoking style versus an instilling style. And, you know, we are really respecting the parent's agency. You know, it's autonomy, it's an autonomy respecting approach. And the spirit of OMI is central to effective communication. Now, also just to really highlight that our well-intentioned desire to fix things for parents by telling them what to do in many cases is counterproductive and results in the parent actually going off in the opposite direction to where we want them to be. And really importantly, parents really want to be understood. So it's so important that when we are with parents, that we listen with the intent to understand them so that we are in the best position we can be to help and support them. So this is quite a useful analogy. So when we're having conversations, you know, with parents, when we're trying to reassure them, it should almost feel like a delicate dance. So you might step on each other's toes every now and then. So, you know, discord may arise, but in the main, you know, you are dancing. It should feel like a delicate dance versus wrestling. So if you're having a conversation, you know, if you're trying to reassure a parent and you feel as if you're in a bit of a boxing match or you're having a wrestle, it's a signal that, you know, perhaps I might be veering more to a directive style, and it might be helpful if I just navigate my way towards more of a guiding style. So if you feel that the conversation's getting a bit prickly, it's really helpful, and I do this very often, ask myself, you know, am I dancing with this person or am I wrestling? If it feels like a wrestle, it's a bit of a red flag to maybe reflect on the approach that's being used and maybe just navigate your way in a different direction. So what I'd like to do is just leave you with this quote. So many of the reasons why old people make so many journeys into the past is to satisfy themselves it is still there. Thank you.